Welcome back. You're watching News Channel 6 at noon. Joining me today, we have Dr. James Green with StarImage Dentistry. Welcome. We're glad to have you back on our show.
Thanks for having us.
Today, we are talking about some new technology here in the Falls, and it's really neat what this can do for patients. And as we teased earlier, it can keep people from having to take that drive to the Metroplex. So let's talk about it. It has to do with implants. Let's talk about what this new machine is and what it can do.
Well, what we're talking about is iCat 3D technology, and it's called a volumetric cone beam CT scan. So it's a little CT scanner that gives us a three-dimensional view of both the upper and lower jaws and the jaw joints. It's very convenient for patients. It has a lot of benefits for them. It's inexpensive. It's an 8-second scan. It's in an open environment, so you're seated upright. You're not enclosed in anything like you would in a big CT scan. The images are available almost immediately, and what it allows us to do is create a three-dimensional view of the patient's jaws on the computer screen, almost like a video game. And then when we're planning implants, where they're going to need to be, where the bone is, all the things that we need to know, we can do all that in 3D ahead of time so that when we get ready to do the surgeries, they're much more predictable. The surgeries are quicker. Oftentimes it saves money and we get better outcomes. So those are the things we use it for with implants.
Let's talk about how far this technology has come from where it once was, because I'm sure this is just so different from what you all used to have to work with.
Absolutely. You know, normally we would use, in the past we would use traditional dental films that are flat two-dimension images, and you know, most of the time, you know, we're good surgeons, we're able to make that work, but being able to spin something around and look at it in 3 dimensions and actually measure, pick out the brand of implant we want and drop it in there, it's just a tremendous step forward. Now, the machine we had before would give us slices and we would be able to do the same thing, but it was about a 45-minute procedure and it would take all these different images and we'd put them all together. This is just a huge time saver for the patients. People can come in and within a couple of minutes we can tell them whether they're a good candidate for implants, what their options are, and it's just a great service.
So a lot of benefits to the patient. Really makes the whole process a lot easier and all of that. Yep. So, well, wonderful. Well, that's pretty neat, and it's really neat that you guys have it right here in town.
Yes, we do. We used to use medical CTs. We also would send people down to the Metroplex to have these taken. We have a scanner in our office that we've been using for quite some time, and there's at least 1 or 2 other ones in town. We also make it available for other dentists, and we do have quite a few people send patients over when they need that information and with the surgeons. So it gets a lot of use. It's a good thing for the patients.
All right. Well, thank you so much for sharing with us about that today. We appreciate it.